Welcome to Simon Says. Thank you for tuning in to another episode. In opposition, the NDC complained about the then Honorable Nicholas Steele being placed as Minister for Health. This after we marched in the street and wrote letters asking for the removal of the then Minister of Health, the Honorable Clarice Modest-Cohen. She was removed and Nicholas Steele replaced her. We then said, yes, because I was a part of the NDC then, we said they put a car salesman to manage the health system of the country. Nicholas Steele was the managing director of one of the most thriving car dealership on island. That is before he entered frontline politics. A businessman. So with him being a businessman, managerial skills, if we put his managerial skills together with the medical and managerial skills of the executive of the hospital, like the chief medical officer, CMO, the director of hospital services, and the director of medical services, among other members, senior members of the Ministry of Health, we started to get a little shift. In June of 2022, the NDC won the election and they replaced the car salesman with, or should I say, the businessman with a school teacher. So we had a little shift taking place. For example, as a matter of fact, the COVID-19 pandemic, Grenada did exceptionally well. As a matter of fact, within the region and even beyond, we were complimented for it. As a matter of fact, I think per capita, Grenada would have been probably in the first 5 in the world for the way they dealt with the COVID-19 situation. And I must say that most of us, if not being biased here, would say that we did exceptionally well. There was a lessening of the cries for medication and supplies, reagents at the hospital. That had lessened somewhat. They managed to get the new wing up and running, and it housed now a number of divisions that we moaned and groaned about, like where the lab was. You have to go up these steps. You have all the people going to get their tests done, their blood work done, and it was always wet and dark, and so the lab. Of course, the emergency division. I mean, we couldn't wait to get that out of that hole down there and sitting outside on those benches. And if we put up a little the signage on the screen, so you can see all that is housed in that new section, what we call the new wing, the phase 2 of the General Hospital. Right? So you see there we have things like the labs and phase, all the different levels are filled. We have the section for the executives, like the CMO and the director of hospital services. They're all included in that division there right now. So as I said, things started to shift, and then the election came, and we have now a school teacher in charge. He's the Minister of Health, a school teacher. Since the elections, we have heard not much about health and what's happening there, even though the administration said that they would put health on the front burner. However, I think they forgot to light the burner. And so health took precedence over most of the pillars, like education, tourism, agriculture. And I agree that because a healthy nation is a wealthy nation. And if you're not healthy, you can't function. You can't function in education. You can't function in tourism. You can't function in agriculture. So I agree. But we have the wrong Minister of Health. The burner is not lit. Every now and then he come out with a health walk to get a little bit attention to that ministry. Yes, we know, and most Grenadians are accustomed to doing their healthy walk. This is nothing new. Grenadians have become quite a healthy group, and they do their walks some in the morning, some in the afternoon, some both mornings and evening. If you go to any of the gyms, especially after working hours, they're filled with persons exercising and things. I think we need to watch what we eat a little more, eat what we grow and grow what we eat, but that too is coming along nicely. So the health walks, yes, they're good, but we're accustomed to that. We walk on our own. We don't need the minister to pull us out, to start to walk. Now, the problem with this administration is that, and it has been with others as well, but I think it is more blatant here now. We put wrong pegs in square holes, and that is because of tribalism and nepotism. We give the job to our friends, people who helped us during the campaign, people, and some of them didn't even help in the campaign. As you've been hearing, they show up after the fact and they got the jobs. But can they do the job? Can they build the ministries? Are we seeing that? And the complaints I've been getting and hearing about is that all of the ministries, not just health, all of the ministries are in chaos, and the ministers are bossy and arrogant and more or less bullying the workers, and they're not getting the job done. They're not getting the job done. So we have a situation where we have the wrong pegs in the square holes, the jobs offered to the boys, and well, as I said, it's better known as tribalism and nepotism. Our ministers, we might well remember that it's about 3 or 4 of them had public service training, has been involved with the public service for some time. Then the others, none, no public service experiences. And then we have a few that has never had a job in their life, or that type of job, really, right? They might have had a temporary job here and there, do something little here and there, but have never had a real job in their lives. So what we have here is inexperience. And we're not talking the age thing. Because the People's Revolutionary Government, they were all young. The Prime Minister, Maurice Bishop, was Prime Minister of Grenada at the age of 34. We had the Commissioner of Police. He was 20 years old. A lot of those guys was within that age group, 19, 20, up to, let's say, 35. And they performed remarkably well as ministers of government, as an administration. The records are there to show. We don't have to go over it. Most of you know what the records are. And so the age and inexperience thing ain't gonna cut it. And then whose fault is that anyways? You took the blooper of the NNP when Dr. Mitchell stood up and said that you all were experienced. You made ad, you worked it, and said that you were experienced. Are you? Right? So the experience and age thing not going to cut it anymore. The thing is, I don't think NDC was ready to rule or to govern, so to speak, and they were caught by surprise. As much as the NNP was caught by surprise, losing the election, the NDC was caught by surprise, winning the election. They were not ready for that. The plan was to at least get their feet in as an opposition. And so spaces were filled as representatives. I do believe, knowing that they were not ready to govern. The Prime Minister in the campaign said, I heard him one time saying that the representative, if they had won the election, the representatives turned MPs, at least the ones that won their seats, not all of them would enter the cabinet. Not all of them would be ministers. And I thought, okay, that sounds good, because I myself was worried. And I said it out in public. So I said it that I didn't think they were capable of managing the country. But the election came, they won, and everybody, all manjack, went up to the ministerial complex, into the cabinet, and the ones that won, of course, in the Parliament of Grenada. You can't deny them that. They're MPs, they're in the Parliament. And now we have to deal with incompetence, arrogance, inexperience, and the whole lot. And the country, might I add, is suffering. The country is suffering as a result. We need to have that, what we call shuffle. We stopped calling it reshuffle a long time ago. Shuffle in the pack. And in my humble opinion, the first one to move is the Minister of Health. We need someone who can manage our healthcare system efficiently and effectively. And I think that is the reason why you decided to put the healthcare on the front burner. We need it badly. Time and time again, we suffer with poor healthcare. And I was happy to hear that this new administration had decided to put healthcare up front and center. So let's get that going. It's almost a year now. And we really don't want to hear the time thing also. Give them time, give them a chance. Then we need a timeline. We need a timeline as to when we could look for the shift, when we can look for the healthcare system moving along. We don't expect all to happen in a day or in a week or in a year even, but we need to see something happening. And we need a timeline when we can critique, because as soon as you say something, criticisms are good, and the Prime Minister himself said so. But when you criticize, and I mean effectively so, you get all sorts of people running out of you saying all sorts of things personally about you, and not about the fact that we need to get our healthcare system moving. So we've heard of they knew, they're inexperienced, give them time, give them a chance. So we need a timeline when we could say, okay, the honeymoon is over. Let's get a move on it. Give us a timeline then. We have the NDC. The NDC have to stop the nepotism, the tribalism, and the victimization of workers for us to move on. We can't just be giving work to people who are our friends and we're not getting our money's worth. They're not qualified for the jobs. So we might as well leave who's there. Yes, there may be supporters of the NNP, but are they functioning? Remember, the Prime Minister spoke of merit. So let's hire by merit and not by party. I can't stress it enough. Yes, you might want to find a job for your members, for your friends, for your supporters, especially the ones who worked assiduously during the campaign, down in the gutter, to get you where you are. But you can't just remove persons, or you shouldn't. I shouldn't say can't because you're doing it. You shouldn't just remove workers, remove persons, because you perceive, and maybe you might know as well, that they're NNP supporters, and you have NDC supporters who need a job, and you give them a job. Are they capable? We're not seeing that. We're not seeing that. So, to come back to health, because that's really the topic, to come back to health, we need to hire more staff. Doctors, specialists. We need to hire nurses on the wards, the emergency departments, the clinics. We need to, I heard only yesterday, a nurse who was temporary for some 20-something years finally resigned because the Prime Minister gave them hope during the campaign. It's a year now. Came in, and what he did, he gave them $500. He said temporary workers is unlawful. And I mean, if you're a temporary worker and you hear that type of campaign, I would vote for them. I would. And wait for my permanency. I would. And it's a year now, and nothing's happening. We already have a shortage of nurses. Can we afford to have our nurses retiring early and resigning and moving on, moving away, migrating. We cannot afford it. We are already way below best standards practices. So let's try our best and get the healthcare system going. Let's try our best and get the healthcare system going. And when we talk about healthcare, it's not just, of course, Carriacou and Petit Martinique are included. And the Prime Minister, in one of his town hall meetings, made it clear that Petit Martinique in particular would be looked at. They would have their own doctor and dentist. In fact, let's play the clip. Let's hear him saying those words to you.
In Petit Martinique. So we recognize that special attention must be given to the healthcare situation in Petit Martinique. There is no reason why there should not be a doctor and a dentist permanently stationed in Petit Martinique to serve the needs of the people of Petit Martinique. And so the National Democratic Congress is making that commitment to the people of Petit Martinique. If we have a shortage of doctors in Grenada, or a shortage of nurses, or a shortage of dentists, and if it means we have to import them until we build up our own capacity, we will do so. But basic healthcare is a right of each citizen of Petit Martinique, Carriacou, and Grenada. And the National Democratic Congress intends to ensure that that need is met.
I have news for you, Mr. Prime Minister. The doctor, every day remains the same. The doctor goes to Carriacou twice a week, Wednesdays and Fridays, and spends 3 hours a day at the clinic from 9 a.m. to 12 noon to catch the boat back to Carriacou and leave to catch the boat back to Carriacou. So 2 days a week, 3 hours a day. And as for the dentist, there's no dentist because the dental chair has been on its way for months now. And every time and whenever the representatives speak of dental work for Carriacou, for Petit Martinique, I'm sorry, he says, as I speak, the chair is on its way. So, not sure where the chair reached now, but it's not in Petit Martinique. And so there's no dentist, no dental services in Petit Martinique. So you might have to look into that and find out what's going on there. But the people of Petit Martinique, I noticed we dropped the Petit Martinique Carriacou Grenada, trying to butter them up, making them feel, well, okay, you are the front runner, and we are living in the state of Petit Martinique. And there are a whole lot of stuff that we need to talk about. Petit Martinique needs its own program. Already have the content, and so we're going to give Petit Martinique their day on Simon Says. To whom it may concern, I'm asking, is the Global Health Ambassador already on the job? Did I hear someone ask Simon Says, who and what is that? Let me tell you. The Global Health Ambassador is the uncle of the Minister of Health, and he was given instruments by the Ministry of Foreign Affairs to network for the Ministry of Health. In my opinion, that's also the job of the Minister for Health, really. But Uncle was hired to go to meetings, to do conferences, to network on behalf of the Ministry of Health. Uncle is an avid supporter of the NDC, has always been, and allegedly put his money where his mouth was during the campaign. He also financed his nephew's campaign. Good, nothing wrong with that. And one has to wonder if the position created, this global health ambassador, is payback. I mean, you can't help but wonder. Mind you, well-educated, well-talented doctor, lives and practices in the U.S. And so I believe, I would say, I think that Uncle should be the minister. In fact, I thought the NDC, after the elections, especially when the Prime Minister said not everyone who took part in the elections as a representative, or even who would have won their seat as an MP, because he said not all MPs would be in the cabinet or have their own ministry. I thought that they would follow in the footsteps of the 2008 NDC government administration and bring in some ministers from outside who are capable, with merit, who would be able to continue what they've met. We say government is a continuum, so we need them to continue. But there's no continuation. So, so I thought, and I do hope, any kind of shuffling taking place would involve people from the outside to come and help us. Help us get a move on it. They can be junior. So instead of they having two advisors in some cases, and all these advisors, they started off with transition leads, then they got advisors, and I don't know, like the advisors are never ending. Let they be the junior ministers, because they're young and they can build up their experience, and then eventually would be able to run and to the country, to govern, and to man their ministries. And so we can get things going once again. So back to Uncle. So Uncle is out there. He now has a diplomatic passport, and he's supposed to be out there networking for the Ministry of Health. And that's what the Global Health Ambassador, that position, created for the first time on Ireland. I want to say, where are we going to put Uncle? Under nepotism, conflict of interest, staring us in the face. Tribalism, nepotism, and we have to try and move on from that and get the things going. There's like a drag, and we could pretend as much as we want. We know the supporters. Everything is nice and dandy. Things are going on. Things are moving on. We can't see them. And on Fantasy Island, maybe. But right here on the ground in Grenada, we need to feel it. We need to see it, and we need to feel it. I'm in retail. I'm in the service industry. It's not there. It's not there. So let's get a move on it. We'll take a quick break and come back. Thank you for tuning in to Simon Says. To ensure that you never miss an episode, click subscribe and make sure to turn on the notifications by clicking on the notification bell icon. See you at the next episode. We have an update 3 weeks ago on Tuesday the 23rd when we had our parliament hearing, our parliament sitting of the lower house. The leader of government business to the question on health coming from the opposition, the leader of government business said he spoke to the Minister of Health. He said, and I'm going to read this because I'm quoting him really. He said they are struggling with the bills. He said it was not just about payment, but that they are determining whether or not meaning the bills, whether or not they are worthy of payment and settlement. And they are trying to unravel the situations. Whether or not, he said, whether or not the bills are worthy of payment and settlement. Now, first thing come to mind is that maybe the invoices didn't have medical stuff on it. Maybe it had personal stuff or things that did not concern the health care system, and so they're wondering if they should pay it. Because you're wondering if they are worthy of payment and settlement. I don't understand that statement. However, on Tuesday, the 6th of June, when the Senate met, where our Minister of Health is sitting, long story short, he said that they paid off the bills. I'm not sure if they checked out the worthiness of the invoices, but he said they were paying over a period of time, and they finally paid off the bills. Just an update there as to where we are, because last episode I begged and pleaded for the payment of the bills, because we are dealing with health, we are dealing with life and death, we are dealing with livelihood, we are dealing with human beings, and probably 90 or 95% of our people use that facility and can't just call an air ambulance or take a commercial flight to the US, to Trinidad, to Barbados, and can't afford the doctors there, and can't afford to pay the high costs. So what we do is sit and die or lay and die. So we're happy. I'm happy to hear that the bills are paid off, and so we can get some meds in the hospital and in the dispensary, and we can help our people to be healthy. And again, as we say, a healthy nation is a wealthy nation. So congratulations to the administration. I guess I know before they would say we don't have to thank the administration for those things. That's their duty. That's what they're supposed to do. We wasn't supposed to thank them for roads and bridges and drains because it's our money and that's what they're supposed to do. Why are you thanking them? You don't have to thank them for that these days. Concrete road and box drains and grills, replacing grills on the side of the road are great achievements. The hypocrisy is too much. It's way too much and too blatant. But I would thank the minister and by extension the government for getting us to this point, and hopefully in the not too distant future we would have reagents and meds and whatever supplies. I heard a gentleman calling on a radio program saying he had to get Band-Aid for his son, go get that in the pharmacy for his son who got a cut. So I really am pleased to announce that according to the Minister for Health, they sorted out everything and we're ready to move. We'll take a quick break and come back. Thank you for tuning in to Simon Says. To ensure that you never miss an episode, click subscribe and make sure to turn on the notifications by clicking on the notification bell icon. See you at the next episode. Welcome back to Simon Says. So we are heading into the 6th month of the year. We're almost halfway there. We're 8 months away from our 50th anniversary independence celebration. 8 months away, almost exactly 8 months away. And the pot is not on the fires yet. The truth is, I thought we would have a year of celebrations, and most people thought so as well. Okay, half year maybe. But what's the menu? The agenda. Where's the agenda for the events leading up to the 50th anniversary celebrations? We have Carnival coming, and that is going to take up a bit of time, cut out a big chunk of our time for the anniversary celebrations. Because basically it's the same set of people are, doing. We have a celebrations committee, and that fall under the Ministry of Culture. And we have the Cultural Foundation. We have the board, the Cultural Board. We have the Carnival, the Carnival, the board for the Spicemas, and we have the Spicemas Corporation, all supposed to be intertwined in such celebrations. But we're not hearing much. The carnival is creeping along slowly. We have the fetes and the shows. Those are all been advertised. There's a big one on the weekend, and those are all being advertised, and things are moving on there. But we're not hearing much from the carnival committee itself, except for the pageantry. We've seen a lot of those in social media and hearing a lot about that. But the calypso and the soca and the mass bands and Pan, I guess, are doing their thing. They normally just, from one year, just flows into the next year and continue their practice sessions. And so I'm assuming they are there doing their thing. But we're not hearing and feeling like we just a couple months away from Carnival. And so we need to hear that and see that as well. But my concern is the celebrations and of the independent celebrations. And we have to bear in mind that next year we also have, it's next year we have the Carifta Games coming to Grenada. We have this big event under the same line minister, sports, that we need to have organized and be ready for. It's a huge event. So we need to prioritize our events and so and you know, the meet and greet in the US and all these things are sideliners. Please, let's get the events and that brings a wealth of monies to the nation, really, and the vendors, and everybody gets a little piece of the pie when we have events like that are well organized. And so the carnival, I'm not sure what's going to happen. Where was the route? Because I realized that the vendors may not be able to use the lagoon this time around. So what's the route of the carnival? Where are these vendors who actually await the carnival season to make that money and to help with getting their kids back to school in September? Especially those who have more than 1, 2, 3, 4, 5, even 6 kids in school and needs to get, that little jolt, that little kakada, as we say, to get them back out to school in September. So we need to hear these things. The stakeholders need to hear what's happening. I'm hearing a lot of grumbling and griping in corners and and what we call word throwing on in social media. And so we have a line minister with two advisors, one of whom we know is not an advisor. He just got the job because he does lime with the big dogs. Or did I say dogs? Mr. Speaker, I mean boys. Liming with the big boys. He's a member, he's a part. So he get this advisor job that they hide in, really. They got sick when it came out in the public. And they don't call his name at all. We don't hear about him. We hear of Patrick Simmons, but we don't hear of this other one. We don't hear about Ian Thomas, who was a friend of the minister. Over the past couple of weeks, separately, I met 2 friends of mine who are overqualified for that job that Django is doing. Ian Thomas, a.k.a. Django. Overqualified and experienced and offered their services. And was ignored. And the next thing they know, more wrong pegs in square holes. Collecting big salary. And we're hearing now that he got a security contract, allegedly so. He got a security contract to serve the building, I think, where he is doing his advisory job. The Ministry of Education, I think it was. But all of that is alleged. Next week program is going to be about security from top to bottom, the entire program. I have so much files, so much content to put together that it's going to take an entire program, and we're going to do it next week. And we would find out if the advisor of these things, because I cannot believe a gentleman of his stature would have stood up in town hall meetings or sit down, whatever position he took then, and throw out these accusations for one, and methods to improve it. And now, what did they renege? Go back on his promises. Yeah, we know. NMP promised gas and we didn't get it. NMP promised to pay the pension and it was never done. Yeah, we know that. Because I know it's that we're coming with. We know all of that. But we have moved on. We're moving forward. We're moving forward. We're transforming. We wanted change. The people listened. The people responded. And they voted for change. So let's get change. And let's not go back to what was done. Because we don't want to do what was done. We want to move forward. How about that? Yeah? How about us moving forward? NDC, we are begging, please, down with the nepotism, down with the tribalism, down with the victimization, down with the conflicts of interest, borderlining corruption, borderlining I'd leave it at corruption. Borderlining corruption. The blatancy with which you're doing it. And as I'm saying again, I'm wondering if the Prime Minister is aware. I'm not sure how the cabinet meetings go. Because for one, the leader of government business, those comments he makes in the House, are those his comments, which I'm hoping it is? Are those conclusions coming from him? Because if those come from the cabinet of Grenada, when he tells the leader of government, the opposition, leader of the opposition, His Majesty's opposition, go and ask the Public Service Commission. And when he speak of the invoices, that he's not sure they're worthy of being paid. This thing has to come from this gentleman here and nobody else. I don't think these things go through cabinet or let's say the parliamentarians, they meet before they go to parliament. But he said he spoke to the Minister for Health. The Minister for Health is saying one thing and he's saying the next. And this has happened a lot with this administration for the past 11 months. No two ministers are on the same page. They don't have a lid on what's happening. Party things end up in government and government. We don't know the difference. There's no separation anymore between party and government. That line is all blurred up. And everybody doing their own thing. Rein them in, Mr. Prime Minister. Rein them in. I noticed just a little lighter moment before we leave. Before I leave, I saw a flyer advertising a town hall meeting in St. Andrew in Grenville. And the Minister of Agriculture was left out of the flyer. And they when asked, and one of the representatives from St. Andrew, the St. Andrew Northeast, And when asked, they were actually asking about the representative, because I don't think most people saw that the Minister of Agriculture was missing. I mean, we're going into the breadbasket. St. Andrew, I believe, produced the most agriculture on the island. And how do you leave out? But they said that it was for parliamentarians and ministers of government who have reports to make. So I'm guessing the Minister of Agriculture don't have reports to make. However, that has since been cleared up, and a next flyer came out, and the first flyer had 15 of them, and this one has 17. So the minister was added, agriculture, and the representative was added. And so we look like we have 17 constituencies now. Who have eyes to see? Let them see. It was nice being here with you again. Thank you for linking up with us. Simon Says would be back next week, same time, same place. You have a great and blessed week. Bye now. Thank you for tuning in to Simon Says. To ensure that you never miss an episode, click subscribe and make sure to turn on the notifications by clicking on the notification bell icon. See you at the next episode.